Imagine having a tool that can help you change how you think and act, improving your mental health. This tool exists, and it's called cognitive behavioral therapy, or CBT. At its core, CBT is a form of psychotherapy that targets negative patterns of thought and behavior. It works on the belief that our thoughts, feelings, and actions are all interconnected, and that changing one can positively influence the others. CBT is a significant player in the arena of mental health treatment, proving effective in managing a variety of conditions. Whether it's anxiety, depression, post-traumatic stress disorder, or even obsessive-compulsive disorder, CBT has shown its worth. It's not just about dealing with present problems, but also equipping individuals with skills to effectively tackle future ones. CBT is a practical, short-term form of therapy that can make a significant difference in your life. CBT is built on several key principles and techniques that aim to change negative thought patterns and behaviors. To understand cognitive behavioral therapy, or CBT, we must first understand its core principles. The first of these is the interconnectedness of thoughts, emotions, and behaviors. This principle posits that our thoughts influence our feelings, which in turn drive our actions. By identifying and altering these negative thought patterns, we can change our emotional responses and ultimately our behavior. The second principle is the idea of being present-focused. Instead of dwelling in the past or worrying about the future, CBT encourages individuals to stay in the moment and deal with current problems or situations. Now let's delve into some key techniques of CBT. Cognitive restructuring, for instance, is a technique that helps individuals identify, challenge, and alter negative thought patterns and beliefs. It's like having a debate with your inner critic, providing counter-arguments to those irrational or harmful thoughts. Another technique is behavioral activation. This encourages individuals to engage in activities they once enjoyed or found meaningful, pushing against the inertia that conditions like depression can create. It's a way of rekindling joy and satisfaction in life. Exposure therapy, a third technique, is particularly useful for individuals dealing with phobias or anxiety disorders. It involves gradually and repeatedly facing feared situations until they become less intimidating. It's a way of teaching the brain that fear is not always a sign of danger. In essence, CBT is about challenging the status quo of your mind. It's about questioning those thoughts and behaviors that hold you back and replacing them with ones that propel you forward. These techniques are not one size fits all, and a skilled therapist will tailor them to suit the individual's needs. But the beauty of CBT lies in its versatility and applicability. Whether you're dealing with anxiety, depression, PTSD, or even everyday stress, CBT offers tools to help you navigate life's challenges. By implementing these techniques in your life, CBT can help you overcome mental health challenges. CBT is not just a buzzword in mental health. It has proven benefits that can transform lives. Cognitive behavioral therapy is a powerful tool in treating a wide array of mental health disorders, from depression and anxiety to post-traumatic stress disorder and obsessive-compulsive disorder. It has shown effectiveness across different age groups, cultures, and settings. But what sets CBT apart is its focus on practical skills. It's not just about understanding your thoughts and emotions, but about learning how to manage them in real-life scenarios. It equips individuals with the skills to challenge negative thought patterns and to cope with difficult situations more effectively. Another striking advantage of CBT is its relatively short-term nature. Unlike other therapeutic approaches that can take years, CBT typically involves a set number of sessions, usually between 5 and 20. This makes it a more accessible and cost-effective option for many. CBT offers the promise of better mental health and a more positive outlook on life. As with any form of therapy, there are questions and misconceptions about cognitive behavioral therapy, or CBT. Let's address some of the common ones. Firstly, is CBT more effective than other therapies? Well, it's not a matter of superiority, but rather suitability. CBT has been proven effective for a wide range of mental health disorders like depression, anxiety, and post-traumatic stress disorder. However, its focus on changing thought patterns and behaviors may not be suitable for everyone. Some people may benefit more from other therapies that focus on past experiences or emotional expression. Then, is CBT only for adults? This is a misconception. While it's true that CBT was initially developed for adults, it has been adapted for children and adolescents with great success. The principles remain the same. The methods are simply tailored to be age-appropriate. So, CBT can benefit individuals of all ages. Another common question is about the role of CBT in conjunction with medication. Does one replace the other? The answer is no. CBT and medication can work hand in hand. In fact, for certain disorders like severe depression or bipolar disorder, a combination of both can be the most effective treatment strategy. The medication can help manage the symptoms, while CBT equips individuals with the skills to cope with their emotions and behaviors. Lastly, some may wonder if CBT is a quick fix. While it's true that CBT is relatively short-term compared to other therapies, it's not a magic bullet. It requires effort and commitment from the individual to identify and challenge negative thought patterns and modify behaviors. The skills learned in CBT are meant to be used long-term, even after therapy sessions have ended. In conclusion, it's important to remember that everyone's mental health journey is unique. What works for one person may not work for another. CBT is just one of many tools available to help individuals navigate their mental health struggles. Understanding CBT can help you make an informed decision about whether it is the right therapy for you. CBT is a powerful tool in the field of mental health, offering hope and change to many. It's a therapy that equips individuals with practical skills to identify and challenge negative thought patterns, modify behaviors, and develop coping strategies. It's effective in treating a wide range of mental health disorders and is relatively short-term compared to other therapeutic approaches. Throughout this video, we've sought to demystify CBT, shedding light on its principles, benefits, and real-life applications. We've also tackled some common questions and misconceptions about this therapy. But remember, while this information is valuable, it's crucial to seek professional help if you're experiencing mental health difficulties. Mental health professionals are trained to guide you through these complex processes in a safe and supportive environment. Remember, understanding and acknowledging your mental health is the first step towards healing. Share the knowledge, like this video, subscribe to our channel, and join us in spreading mental health awareness.